Which of the following best describes the primary anatomical defect in tricuspid atresia? A. Narrowing of the tricuspid valve orifice. B. Complete absence of the tricuspid valve with no communication between the right atrium and right ventricle. C. Displacement of tricuspid valve leaflets into the right ventricle. D. A hole in the tricuspid valve leaflets. Answer B. Complete absence of the tricuspid valve with no communication between the right atrium and right ventricle. In tricuspid atresia, how does blood typically exit the right atrium? A. Through the pulmonary valve. B. Through a ventricular septal defect, VSD. C. Through an atrial septal defect, ASD, or patent foramen ovale. D. Through the superior vena cava. Answer C. Through an atrial septal defect, ASD, or patent foramen ovale. Which heart chamber is characteristically hypoplastic in most cases of tricuspid atresia? A. Left atrium. B. Left ventricle. C. Right atrium. D. Right ventricle. Answer D. Right ventricle. What is the most common clinical presentation in a neonate with tricuspid atresia and decreased pulmonary blood flow? A. Hypertension. B. Severe cyanosis. C. Excessive sweating during sleep. D. Brachial femoral pulse delay. Answer B. Severe cyanosis. On an electrocardiogram (ECG), which finding is highly suggestive of tricuspid atresia in a cyanotic infant? A. Right axis deviation and right ventricular hypertrophy. B. Left axis deviation and left ventricular hypertrophy. C. Normal axis and normal voltages. D. Prolonged PR interval only. Answer B. Left axis deviation and left ventricular hypertrophy. Which associated defect is necessary for survival in a patient with tricuspid atresia to ensure systemic blood reaches the lungs, in the absence of a PDA? A. Coarctation of the aorta. B. Ventricular septal defect, VSD. C. Bicuspid aortic valve. D. Mitral valve prolapse. Answer B. Ventricular septal defect, VSD. Tricuspid atresia is frequently classified based on the relationship of the great arteries. What does type 2 typically refer to? A. Normally related great arteries. B. Detransposition of the great arteries. C. L-transposition of the great arteries. D. Truncus arteriosus. Answer B. Detransposition of the great arteries. What is the primary purpose of administering prostaglandin E1, PGE1, to a newborn suspected of having tricuspid atresia? A. To close a ventricular septal defect. B. To maintain patency of the ductus arteriosus. C. To increase systemic blood pressure. D. To induce closure of the atrial septal defect. Answer B. To maintain patency of the ductus arteriosus. In the Fontan procedure, the final stage of surgical palliation, the systemic venous return is directed to which of the following? A. The left ventricle. B. The aorta. C. The pulmonary arteries. D. The left atrium. Answer C. The pulmonary arteries. Which physical exam finding is typically heard in a patient with tricuspid atresia and a significant VSD? A. Holosystolic murmur at the left lower sternal border. B. Mid-diastolic rumble at the apex. C. Continuous machinery murmur at the left infraclavicular area. D. Ejection click at the second right intercostal space. Answer A. Holosystolic murmur at the left lower sternal border. Chest X-ray findings in a type 1 tricuspid atresia, normally related great arteries, usually show A. Egg on a string appearance. B. Increased pulmonary vascular markings. C. Decreased pulmonary vascular markings and a concave main pulmonary artery segment. D. Boot-shaped heart with massive cardiomegaly. Answer C. Decreased pulmonary vascular markings and a concave main pulmonary artery segment. The Glenn procedure, superior cavopulmonary anastomosis, is typically performed at what age? A. Within the first week of life. B. 3 to 6 months of age. C. 2 to 4 years of age. D. Adulthood. Answer B. 3 to 6 months of age. Why does tricuspid atresia lead to left ventricular hypertrophy? A. The left ventricle must pump the entire systemic and pulmonary venous return. B. High pressure in the right atrium directly affects the left ventricle. C. There is a primary genetic defect in the left ventricular myocardium. D. Systematic hypertension is always present. Answer A. The left ventricle must pump the entire systemic and pulmonary venous return. If a patient with tricuspid atresia has transposition of the great arteries, type 2, they are more likely to present with A. Excessive pulmonary blood flow and congestive heart failure. B. Severe pulmonary stenosis and profound cyanosis. C. Absent peripheral pulses. D. Left to right shunting at the atrial level only. Answer A. Excessive pulmonary blood flow and congestive heart failure. What is the fundamental goal of the multi-stage surgical palliation, Blalock-Taussig, Glenn, Fontan, for tricuspid atresia? A. To create a functioning tricuspid valve. B. To separate the systemic and pulmonary circulations using a single functional ventricle. C. To transplant a donor heart. D. To reverse the hypoplasia of the right ventricle. Answer B. To separate the systemic and pulmonary circulations using a single functional ventricle.